Welcome to my channel. This is going to be my first video on this channel, and today I want to talk about the different kinds of medications that I personally have been taking and have been prescribed over the past 2 or 3 months. For me personally, it's been a very diverse travel. I've had, a whole bunch of different medications, a total of 15. I have some that I still have at home and that I'm going to show you today, but I can tell you about the experience of the ones that I don't have with me as well. So the first one that I've been taking for a very long time now is fluoxetine, and this was before my borderline diagnosis came. I really like this one because it does help with the depression that for many people comes along with borderline, even though it does have a few side effects that you could also Google. But for me personally, the first few weeks, and also every time they up my dosage when I took this, I would feel restless. I had sleeping issues, which I got other pills prescribed for. But overall, I just want to say that this, now that it's balanced out, does work for me. I do feel less depressed. I have found a dosage that works for me personally, which is 30 milligrams. Also, this is known as Prozac in the USA, so if you've never heard of fluoxetine, maybe Prozac to you is something that you have heard of before. I think it is a kind of antidepressant that is more known to the general public. So that's for the antidepressant number one. Then there's another one I take, and that will be trazodone. And trazodone is also an antidepressant. It is taken in very different dosages depending on what you need for it. For me personally, since I've already got an actual antidepressant, this one I take for going to sleep now because I am trying to get off any type of benzodiazepine that I've been taking before, which I'm going to talk about later. But this one is also an antidepressant, just like mirtazapine, for example, a drug that you would take before going to bed because it does make you tired. And this is why I've been given this, because it's a non-benzodiazepine drug. You can take this to go to sleep. For me, it just really makes me tired at night. It helps me fall asleep. I've been doing really fine with this. I usually take 50, so that's half one actually. And if I really cannot fall asleep, I'll take another half, so I'll take a full pill. But usually a half one of these ones is enough for me to just get along fine, and it helps me very much falling asleep. I know that this can be taken as a mild antidepressant as well, but I'm not quite sure about how high of a dosage you would have to take of this in order to have an antidepressant effect. So now I'm going to go to the entire group of benzodiazepines because I've also taken a whole bunch of, different benzodiazepines in the past, 3 of which I still have prescribed now and I have at home, but I try to not take as much as I can. I'm going to start out with this sleep med, which is zolpidem. This is one of the so-called Z drugs, Z sleeping drugs. You're going to have the issue that at some point they're not going to be working as well as they did, at the beginning. So for me personally, I had taken zolpiclone at first to combat the sleeping issues that I got from the fluoxetine, and I took it for about a month on and off. Like whenever I could fall asleep without the drug, I wouldn't take it, and if I had a really hard time just to get tired in the evening, I would take it. And then at some point, one pill of zolpiclone, which for me was 7.5 milligrams, would just not be enough anymore in order to make me fall asleep. And that's when I started trying a different one, which is this one. This one hasn't worked as well as zolpiclone for me because it has a shorter half time. Yeah, I haven't really taken these in a while because they just don't do much for me anymore. Then on to alprazolam, or as many know it, Xanax. I have been taking alprazolam for quite a while. I really do like alprazolam, and it does work very well for me personally. I try to not take it. This is more of, an emergency kind of medication for me. I've taken it to go to sleep before. I've taken it in lower dosages during the day if I felt very anxious or if I was about to have like a panic attack. This is the one that works the best for anxiety, especially. Just make sure that you're not on this specific drug for too long because it's not good to take for a prolonged time. Then the next benzodiazepine that I have is diazepam, or otherwise known as Valium. And this one is a very strong drug in itself because it has a very long half time. Out of all the benzodiazepines, this one has the longest half time, and I think it's up to 100 hours depending on how old you are. It's longer for older people. During the day, I've never taken this, to be honest, because I felt like it really just tires me down and doesn't, I'm not really able to do anything. Do I recommend this? Depends on what you're looking for. I think if you have really bad anxiety and you take this at night, like in a short-term setting, so maybe like no more than just 2 weeks, this can be a solution because this is gonna still work in the morning and kind of, well, stop you from having more anxiety attacks in the morning as well. This is a really high potency drug, and this is not something that usually gets prescribed very lightly. For my condition, for borderline, doesn't really do much. It's more of a like really knockout drug, like when I'm self-harming or when I'm doing something else crazy. It takes a long while for me to even start feeling the effects of it, which is why I don't think this is very well a very good medication for borderline itself. I've also had lorazepam, also called Ativan in the past, which is more on the lighter side with benzodiazepines. And personally, it didn't do much for me. I know that there's a whole lot of people that take this. I get along way better with alprazolam. So if there's any benzodiazepine that I can recommend, it's gonna be alprazolam because it works in a way that can be useful either as a sleeping aid or as an anti-anxiety drug just to calm me down in general. Another thing that I've got prescribed is quetiapine, which is also known as Seroquel. This, on the other side, is not a benzodiazepine. This is a neuroleptic or antipsychotic drug. I know a whole bunch of people that take antipsychotics like this one and they gain a little weight. This one makes me really, really, really tired. So I cannot take quetiapine during the day. It's more of a alternative to taking alprazolam, really, when I could take this in order to bring me back down when I really want to go to sleep badly. Personally, this is not one of my favorites. I'll take it if there's nothing else I can do, but it's not necessarily something that I would recommend to, as something to calm you down, if you will. Then I've got a diagnosis of ADHD. This is a generic brand of Ritalin, basically. But the main ingredient is methylphenidate, and that's 10 milligrams. This one right here. I'm probably gonna switch soon to just a single dosage of 20 milligrams because it saves time and I don't need to remember taking something else in the noon. This one I feel works very well for ADHD. I personally like it. Then I have another, and this one right here is modafinil. Modafinil is usually known as being a sort of like a study drug for many people. It was prescribed for ADHD for me, which to me didn't make any sense at all. I've taken it like once or twice and I haven't felt any different whatsoever. I know this is a low dosage, but from what I've read about this drug, like I don't see how this would help me in any way. It increases impulsivity, which is something that certainly you do not need when you have borderline personality disorder. Not using this one for sure. Some of the other drugs that I've taken in the past include temazepam, which is another benzodiazepine and also usually used as a sleeping aid as well. Again, it's a benzodiazepine, so it's not ideal, but it does work very well in me personally. Yeah, that's pretty much all. And then for neuroleptics, I've also taken promethazine before, which where I live is known as Atozil. Well, I didn't really feel good on it. They used to give it to me to go to sleep, and I didn't enjoy it much. And that's it for the actual psychiatric drugs that I'm taking right now. But I do have a fair bunch of scars. I also take an iron supplement because I've been anemic for a while now, and especially because I cut myself, I have a bigger blood loss than maybe a regular female would have anyway. And this over time I've just become anemic, and now I'm taking an iron supplement because iron is something that I know I'm deficient in. I get my blood work done regularly. Yeah, that's pretty much it for the different things I take.